Products are shown for demonstration purposes only. The AHA does not endorse or recommend any specific manufacturer or product. In order to show skills clearly, the healthcare providers in this video do not always use personal protective equipment, such as gloves. Intraosseous, or IO access, can serve as a rapid, safe, and reliable route for the administration of drugs and fluids when peripheral venous access cannot be rapidly achieved. The IO route provides access to a non-collapsible venous plexus, which is especially useful during resuscitation. Although providers should attempt to establish IV access as the first attempt for drug administration during cardiac arrest, IO access is an acceptable alternative when IV access is unsuccessful. IO access also provides an alternative route for the administration of crystalloids and colloids. Many sites are appropriate for IO infusion. See your device-specific instructions for a list of approved sites. For adults and older children, the most common sites include the proximal tibia, the humeral head, the medial malleolus, and the sternum. After the IO needle is properly inserted into the bone and appropriately secured, drugs and fluids flow through the bone marrow cavity into the circulation, though depending on location, they may first pass through peripheral circulation. As is routine practice when providing most IV drugs, all IO medications are followed with a flush of 5 to 10 milliliters of normal saline. Keep in mind that even after successful insertion of the catheter into the bone marrow, there is often resistance to infusion, which a provider may mistakenly interpret as incorrect placement. Bolus administration or the use of an infusion pump should help with this. Healthcare providers should keep in mind that certain contraindications exist. Contraindications to IO access include fractures and crush injuries near the access site, conditions with fragile bones, such as osteogenesis imperfecta, and previous attempts to establish access in the same bone. If infection is present in the overlying tissues, IO cannulation should be avoided. After IO cannulation, providers should check the site frequently for signs of swelling and needle displacement. Remember that fluids or drugs delivered via a displaced needle can cause severe complications, such as tissue necrosis or compartment syndrome. IO needles are intended for short-term use, generally less than 24 hours. Replacement with long-term vascular access is usually accomplished in an intensive care setting.